And we'll begin by reviewing Lecture 2 very quickly or briefly. And we'll begin with the third limb of Ashtanga Yoga, which is asana. So go ahead once again in the chat, just chime in about what asana is. Define it for me. A postural pose, yes, but specifically to place the body in a special way. That was vinyasa, actually. Remember what asana was? Yes, it's pose, but what was the exact thing that Patanjali said in Sutra about asana? Do you remember? Yes, to sit firmly and comfortably. Comfortably was really the main word that we want to focus on. Alrighty? So yes, asana does mean pose, and that's really for the layperson. It's for someone who isn't well-versed in yoga. And as yoga therapists or as practitioners of Ayurveda, we want to become more aware of the deeper layers of yoga therapy. And knowing precisely what an asana is very instrumental in beginning to offer yoga therapy to our clients, and in effect, beginning to offer the so-called basic poses. If you think that asana is a pose, you'll never be able to offer a therapeutic approach to your Ayurvedic clients, because you'll give them maybe a pose that isn't firm or comfortable. You might give them one that's uncomfortable. So we have to start with the basics of asana. And remember, Patanjali in the Yoga Sutras defined asana as one where you can sit firmly and comfortably. And so if you can remember, we had many benefits of yoga, and as a matter of fact, some of the medical community is jumping on board now, and I shared with you some of the 77 different benefits of yoga that the National Nursing Association had listed. Can you list some of those benefits, maybe some of the 77, or maybe even some of the own benefits that you have noticed in your own practice? Flexibility, sure, that's one of them. Strength always comes with it, doesn't it? Balance, lowering blood pressure. What else is a good one? Balanced digestion, very good, since that's one of our things that we want to balance with yoga. We would hope that it would balance digestion, right? Balance Agni. Reduce hypertension, I agree. Anything else that you can think of? Well, what I think, and I shared with you back when I went into my yoga training many years ago, it was really off limits to say that yoga had any direct effect on anything that was a disease or centered in the medical community. Rishi says increased tolerance to pain, increased immunity. That's very good. But now in this day, the community is coming on board, the medical community, the lay community is coming on board and realizing that yoga definitely has effect on the mind, the body, and the spirit. We can say that it reduces or has an effect on depression. We can talk about irritable bowel syndrome, colitis, and we'll talk about it in Lecture 2 or Lecture 4 quite a bit. But you can just go down a list of anything really medically, and I believe in my heart of hearts that we can help it through yoga therapy. And some of the Ayurvedic texts even say that a disease that is incurable should be managed with yoga therapy and pranayama, and then you will get the full effect or get the full healing. So I want you to start to open your mind and think in this way as healers, that yoga therapy can be a tool for anything. If someone has Tightness, of course, we can cure that or help that, manage that. But even these deep-seated illnesses, someone talked to me on the forum about PCOS and how they had been cured through yoga practice with this. I believe this in my heart of hearts, and I have helped many people. Things as severe as schizophrenia, I've helped people with schizophrenia and depression and sleep disorders and psoriasis and so many things just through the practice of yoga, not necessarily even with Ayurveda taken in. Now that I have the full gamut of Ayurveda and use the yoga therapy in conjunction with the Ayurveda, to me the pathways are endless, or our capacity as healers or helpers in management of pain and disorders is endless. So, can you list for me a few of the pillars of Krishnamacharya's yoga therapy? Remember, there were 9 of them, and there was one that I really wanted to focus on. What are the pillars of Krishnamacharya's yoga therapy? Yukta, yes. What's next? Vara. Next. Deha. Very good. Kala. Very good. So I see you have them. Very nice. I'm very impressed with all of you. And it's important to speak in the Sanskrit, and it's not necessary even that we translate at this point, is it? You and I should be able to verse. Bala can be thought of as child, but it's also thought of as strength in this context. It's different than Shakti. Shakti is more power or energy in that way. Bala is more your strength, your capacity to do something, to maintain a posture, for instance. Alrighty? Now let's move on to the definition of vinyasa. What was the definition of vinyasa? And you had it earlier, I think, Nicole. Yeah, to set in a special way. Exactly. So remember, lay people or people in the West think of vinyasa mostly as flow, and they think flow yoga or movement yoga is vinyasa. But really, vinyasa means to set in a special way. Alrighty? And when we think of this, setting the body in a special way, then really all of yoga, all of asana is vinyasa, isn't it? And this is a very important concept because poses are not static, number one. Even poses where you sit firmly without any kind of movement, the breath deeply moves the body to conform to different areas of awareness. There's deep movement in the body, sometimes without us being aware of it. So vinyasa is very important to understand that we're able to achieve this vinyasa style or this vinyasa just by having care of the body and by placing it in a way that we don't cause harm, but in a way that we're able to communicate with it, with our breath, with our mind. Alrighty? We'll move on then to what hatha means. What is the definition of hatha? Yes, remember it has at its base ha and ta, the sun and the moon. And specifically, what does it refer to? Forceful, exactly. Hatha yoga is forceful yoga. That sounds like we want to move with force or energy or power, that sort of thing. What it really means is that we're using our muscles, we're using our physical energy to place the body in a special way. Okay? So remember, as lay people, sometimes in the West, we'll use hatha to define a gentle style of yoga. Really, all of yoga, all of physical yoga, all of the posturings of yoga are hatha. They use posturing, this hatha yoga, that place the body in a special way, yes, but that are also forceful in movement. Not in a pushing or a forcing kind of way. It just means that you're using the force, the energetics of the body to move. And what did we define as basic yoga? It is personal, very good. It's suitable to the individual. What else? Specific yoga for the individual, exactly on head. And here's a real important one, especially if you have read some of the threads on the forum and some of my responses to some of the poses, for instance, like Paschimottanasana. Some people would think Paschimottanasana is a very basic pose, but in essence, it's a very difficult pose. Seated forward bending, you would think, well, everyone can sit and forward bend. Well, not really. What happens is the spine becomes limp, the torso becomes caved in, the heart chakra is clogged, Sushumna Nadi is curved and bent, so no prana can get sent in. Most people have deep pain on the back sides of their thighs from forward bending, stretching the hamstrings. So I don't think Paschimottanasana is a basic pose. Why? Because it isn't able to be met or found without modification. Also, Paschimottanasana isn't able to be met or performed without a warm-up or a cool-down. Remember, a basic pose does not contradict a person. In other words, it isn't too difficult for the specific person, and it doesn't contradict the time of day. A basic pose brings balance. A basic pose is definitely a place where you can sit comfortably and firmly. So Nicole says, well, you can begin with an erect spine and to start to open the nadis along the legs and the back. Well, yes, I agree, but I'll tell you what, I think I've shared with you, I've really taught thousands of classes over the last 17 years, and who knows how many people, and many privates. And Paschimottanasana, that forward bending, is the most difficult pose to teach. And it's the most difficult to keep people in strict alignment. And what I think I'll do somewhere around lecture 5 is I'll take just Paschimottanasana and show you the different variations and the different mistakes that people make in the pose and why it is so unsuitable to tell someone to do it at home by themselves. Because if they do it at home by themselves, what's going to happen? You're going to have a breakdown of form. It's not going to be, the pose is not going to be, for that reason, beneficial, and may even cause damage to the individual because of poor alignment. So we'll move into that further in later lectures. But remember, when I put in these specific bullet points here from lecture 2, these are the things as a yoga therapist, as an Ayurvedic practitioner, that you must be aware of. You must be really firm in the definitions of asana, the pillars of yoga therapy that Krishnamacharya set down, vinyasa, hatha, and also what basic yoga is. Alrighty? These things will be the foundation of your understanding of yoga therapy and, most importantly, your ability and capacity to help people through yoga therapy. Now remember, yoga therapy is completely different than yoga. I'm not teaching you to be yoga teachers. That would be completely different. We would be learning how to warm up the body, how to do prep postures, how to perform postures specifically. We'd have a sequence of maybe 10, 15, maybe even 20 postures. We would learn how to cool down the body. You know, it would be something completely different. Here we're talking only about 1, maybe 2, at the most 3 postures that we'll be giving as a protocol to our clients. okay? And I'm going to go out on a limb a little bit and say that yoga therapy isn't exercise. Yoga therapy really is the connection with the spirit, the body, and the mind, but it really is the cessation of the turnings of the mind. It's yoga at its deepest, and that's why we spent such a great amount of time studying the yamas and the niyamas, because we have to realize that controlling the mind and controlling our actions, how we treat others, how we treat ourselves, is so much more important than any asana you will ever do. And ultimately, the yamas and the niyamas will set the base for your understanding of the physical body. If you're able to control your actions on a day-to-day moment, if you're able to control your daily routine, your dinacharya, well, goodness, an asana is an easy thing to control, isn't it? So here's how we began to understand that yoga therapy is different than teaching a yoga class. There may be yoga teachers out there listening right now. It's completely different. And knowing these basic parameters is going to be important as an Ayurvedic practitioner to offer yoga therapy to your clients as part of your protocol. Okay? So since the purpose of yoga is to balance the 5 vayus, bring Agni to a state of balance, and balance the flow of energy in the nadis, today we will learn asanas for each of the vayus. Now, as we move on, remember, these are just suggestions, and they're definitely malleable. In other words, there could be hundreds of postures of asanas that would relate to each of the vayus. These are just a few that I thought I would share with you today. Begin with Apana Vayu. Apana Vayu resides in the pelvic region, remember, in the colon. It also resides in the urinary tract, the vagina, the cervix, the testicles, and the prostate. Vitiated Apana Vayu symptoms include constipation, diarrhea, retention of urine, no menses, and sometimes even heavy menses if we have a complete vitiation of vata, premature ejaculation, low libido, back pain, and sciatica. Now, asanas for Apana Vayu would include Malasana, which tones the abdominal organs and relieves backaches and eases menstrual discomfort. Baddha Konasana, which is good for the prostate and urinary disorders, regulates menstruation and helps ovaries to function normally. And Pawanmuktasana, which helps to expel air in the colon and aids constipation. It also relieves tension in the low back. Now, all of these benefits are from B.K.S. Iyengar's Light on Yoga book. And if you don't have that book, I'd say you use it as your Bible. It's just a fabulous book. I've had it for many years and still use it to this day, many, many times in a month. You know, it's just a fabulous book. So let's go into Malasana. Remember that asana, of course, means posture, and then all the other deeper definitions of asana. But what does mala mean? Mala means garland. So I'm showing a variation here of malasana. Malasana would generally be squatting without the sit bones on the ground. This is a variation that would be considered a basic pose. Why? Because it's suitable to perform without any kind of a warm-up, without any modification whatsoever. It doesn't contradict the time of day, or probably 99.9% of people. In other words, everyone can do this pose. The benefits, aside from what Iyengar said, which was it's good for the prostate and bladder, the liver and the spleen, and it helps the liver and the spleen to cease to be sluggish. Anger also says the intestines will benefit. Aside from that, also, I've noticed it's deeply supported for menstrual cramps, for instance. Also have used it for people who are unable to conceive, for women who are unable to conceive. So Malasana, a very, very powerful pose. And of course, this was the variation. Baddha Konasana. Baddha means caught or restrained, and Kona means angle. And here again, you'll notice this is a variation of Baddha Konasana. Supta Baddha Konasana, or reclining. I also have a support on the wall here. Regular Baddha Konasana, when you're seated, can become uncomfortable for most people. Once again, they're unable to support the spine and sit for a long period of time. And usually the shoulders will start to sloop down in a seated position. And so this reclining position is very supportive, very beneficial to, again, 99.9% of people can do this. If you can lie down, if you can relax, you can perform this posture. And the benefits, again, stimulates the abdominal organs, the ovaries, the prostate, the bladder, and the kidneys, stretches the inner thighs, the groins, the knees, and soothes menstrual discomfort. We also talked a little bit on the threads on forum that some postures, while yes, they'll be very basic and most people can perform them. For instance, we'll talk about Tadasana later on in the slide presentation. But just briefly here, you want to make certain that you give postures that suit the individual, of course, right? And suit their profession. What if you have someone that works all day on their feet? You definitely would not want to give them Tadasana, for instance. Most people, even if they don't have a job where they have to stand all day, they come home and they're tired. And giving them something to do that requires a great amount of strength, usually they'll choose the option of not doing the posture. So when I give yoga therapy, I really attempt to give yoga therapy asanas that are deeply calming and relaxing. And then I manage their energetics. In other words, if I'm trying to balance Vata, Pitta, or Kapha, what I do is I balance it with the breath. So I'll give a more energetic breath for Kapha, a very stabilizing breath and calming breath for Pitta. And for Vata, I'll give, again, a very calming, maybe something like Nadi Shodhana. And we'll talk about pranayama in lectures 5 and 6. But just for today, know that when we're looking at asanas and offering them to our clients, you want to give postures that don't require any modification, don't require a warm-up or a cool-down, and give postures that are very calming and relaxing, where people don't have to do a lot of work to do it. Because trust me, if you give them work to do, they won't do it. So we want to make certain that they adhere to the protocol. So Pawan Muktasana, Pawan is air or gas, and Mukta means free or release. So this is the air or the gas relieving posture. Really great posture for the low back. And of course, we remember that the benefits in the wind relieving yoga pose is that it relieves excess gas from the stomach and the intestines. It improves the digestive system. And this yoga pose will also tone and stretch your low back. Now, if someone has knee problems, you want to hold under the calves instead of around the legs. You notice I'm holding around the ankles and pulling inward. Sometimes it can cause a little bit of pressure on the knees. So if someone has knee problems, just have them hold under the thighs instead of around the front side of the calves or around the shins. So any questions on Apana Vayu or any of the postures? Any feedback on them? But to begin with an erect spine, oh yes. Okay, we'll move on to Samana Vayu. Samana Vayu provides a stimulus for digestion, absorption, and assimilation of food. Vitiated Samana Vayu symptoms include a loss of appetite, bloating, gas, and malabsorption. Asanas for Samana Vayu include Navasana, which improves digestion, stimulates the kidneys and intestines. Twist, which stimulates Agni, increases appetite. Vashisthasana improves digestion and increases blood supply to the abdominal organs. We're going to spend a lot of time on Samana Vayu, and a lot of different postures will be covered. Next lecture, we'll be spending time on how to balance Agni, and you'll notice that some of the postures of Samana Vayu will coincide with the postures of Agni. And here again, how you would direct your intention as a yoga therapist or Ayurvedic practitioner to the specific ailment would be by managing their breath, their pranayama, while they're in the pose. And that would help you direct the energy to either Samana Vayu or just our Agni. But we'll talk about that in later lectures. But just know, as a basic format here, we're just going to talk about the asanas in this basic format without pranayama. So Nava means boat, right? And here I'm in Ardha Navasana, or half boat. My knees are deeply bent and my thighs are very close to the midline of the body. Remember, if my thighs would come away from the midline of the body, I would start to work or activate the psoas and the muscles on the front side of the leg, or up high in the hip and the front side of the body, the hip flexors. And people normally will get very tired and won't be able to perform Navasana because they'll have pain in the crease of their leg. And so in order to keep that from happening, bring the legs really close to the body, then the hip flexors disengage from contracting and you can focus more on the belly instead of the hip flexors, alrighty? The benefits: relieves bloating and gas in the abdomen area and provides relief for gastric disorders, tones the waistline and kidneys, and works on the liver, the gallbladder, and the spleen. Paripurna Navasana, here's the full boat. Now here also, look at the crease at my thigh and my torso. My legs are not far away from my body again, and the spine is erect. If the client is unable to keep the spine erect, or if the legs come far away from the body, it would be better to do the half boat, Ardha Navasana. And the benefits again: stimulates Samana Vayu, tones abdominal and back muscles, good for pelvic inflammatory disease, amenorrhea or loss of menses, and PCOS. Contraindications would be, of course, a weak back or belly. But if you do the half boat, that of course would work on the weak back and the weak belly, and you'd be able to strengthen the back and the belly so that you could do the full variation. It's not even really necessary so much to do the full variation, but Iyengar says that Ardha Navasana and Paripurna Navasana have different effects. Ardha Navasana has effects more that are centered on the liver and the spleen, and the full Paripurna Navasana has more effects that are more intestinal, more on the intestines. So there again, you would have to work with your specific client and what you were trying to achieve. in your recommendation of Ardha or Paripunanavasana. Parvrita means revolved. And here I'm in a somewhat basic looking pose. Twists are very deceiving. Twists are one of the places where clients can injure their back very easily if their belly is not supporting the spine. If the bandhas, and we'll talk more about bandhas, the locks in later classes, but if the bandhas are not intact, if the belly is not supporting the back, if you twist without the support, you're opening the door for injury. And also you'll notice my spine line is very straight. Look underneath my armpit all the way down to the floor, a straight line. If the client had a big gap in the low back or rounding in the low back or in the high chest, this wouldn't be a basic pose. Now let's look here. The benefits, of course, were benefits the liver and the spleen. It ceases the sluggishness there. The intestines will benefit. The size of the abdomen decreases. And it's really important to have complete awareness of the spine line. And when you twist, exhale. Remember, when we exhale, we bring the belly inward. And so this bringing the belly inward is what protects the spine, the contraction, that subtle bandha that occurs on the exhale. So supta, reclining or asleep. So this might be a pose, a twist, that would be more suitable for more people. But you want to look again at the line from my armpit down to my hip, a straight line again. Here I have my legs intertwined in Garandasana, legs or eagle legs, but it isn't necessary that the legs are like this. I'm sure many of you are aware of many reclining twists where you can straighten the legs or have the knee bent. The main thing always is the spine line is straight. Why is the spine line so important? Well, what resides on the spine line, Sushumna Nadi, mirrors the line of the spine. And if we crunch or bend Sushumna Nadi, how is prana ever going to get through? We'll talk about Sushumna Nadi and prana in our pranayama class, but as it relates to the spine line, we have to make certain that the spine line is straight when we give yoga therapy protocols to our clients, because if they go home and they perform the posture with a crooked spine, they're not going to get the benefit. It's a good stretch, that's all well and good, but prana won't flow adequately through Sushumna Nadi, and I don't believe you'll get the deep benefit from the posture. So this is really important, is maintaining that straight spine. So the benefits of the twist: tones and eradicates sluggishness of the liver, we talked about already. The spleen and the pancreas are also toned, cures gastritis and strengthens the intestines, relieves low back pain. Always remember to have attention to the breath when entering the pose. So here's a posture. Parsva means side, and Baka means crane. So Parsva Bakasana. Now think of the poses I've shown you already. The seated twist, remember, the reclining twist, and now this arm balancing twist. Now tell me, remember we thought about what a basic posture was. And a basic posture is one that's suitable to the individual, that doesn't require modification, warm up, or cool down, right? It doesn't contradict the time of day, and it brings balance to the body, mind, and spirit. Now, tell me about this posture. Would this be a basic posture? Anyone else? So very good answers. So remember last time I showed a very difficult pose, and remember it was Titibhasana, the firefly, and I said, well, is this a basic pose? And some of you said, no way, that's not a basic pose. And I said, well, yes, it is a basic pose for me. I can get into that pose without modification. I don't have to warm up. I don't have to cool down. And I'm very secure and comfortable in it. Remember that pose? So here I'm kind of tricking you a little bit because I want you to really think about the postures and even beyond the individual. And remember that twists are always going to be in a separate classification. Twists always require deep awareness and some kind of a warm-up or cool-down. Why? Because they're working deeply with the spine, deeply with where our synaptic pathways merge at the chakras, and we'll talk more about chakras in later classes. So even though I can perform this pose with ease, I'm comfortable, I don't need modification, warm up, or cool down, I need to warm up before I perform this because it's a deep twist. So you have to be careful. Yes, it's determined on the individual, but just because I can do this, I shouldn't. I shouldn't do it without a warm-up or a cool-down. Now, would I be able to do the reclining one without a warm-up or a cool-down? Here's where it's more yes, no, maybe so. Now, can I move with intention? Can I move slowly? Can I keep the spine line long? Can I keep the belly strong on the exhale? Then this is a basic pose, right? And we already talked about the seated one. So twists are almost in a little category all of their own. We have to be really careful when we give twists as a protocol. All right? And always give twists that are easier, in other words, like this one, and can be performed definitely without any modification instead of this one. So that was a little bit of a trick question. Say I was your client, would you give me this twist? No, you wouldn't. Would you give me Titibhasana, the firefly? Probably. Okay. So we'll go back again to the benefits of twist. Tones the abdominal organs, good for intestines, no menses, contraindications, weak belly, arms, wrists. Even for an advanced practitioner, this pose would need a warm-up, including prep poses and cool-down poses. Vashista, best or excellent. And we're still just on Samana Vayu. Now this is a half version where I have the knee bent. Most people can do this posture. I like it because it's a place where we can start to help our clients become aware of the energy between the back and the spine, and that the two are linked. The belly center and the spine are so linked. And of course, that'll help them balance many of the elements of Samana Vayu. And this strengthens the lumbar and the coccyx region of the spine, builds awareness of belly and spine connection. Visvamitra is the sage. So here I'm performing on a rock, and I have the leg up in the full expression of the pose. And so again, would this be a basic posture? And I won't try and throw any kind of a trick on this one. This is definitely a basic posture. I don't need any warm up or cool down with it. I've developed enough strength over the years to perform it very easily. I'm very comfortable. It would be a suitable pose for someone who had the strength to perform it. It would be suitable as a basic pose, suitable for yoga therapy. Okay, very different than the difficult twists. Twists are very separate on their own. Okay. And we talked on the forum also about the different camps, Iyengar and Pattabhi Jois, and you remember the history and the connection between Pattabhi Jois and Iyengar, and Krishnamacharya taught both of them. Iyengar was Krishnamacharya's brother-in-law, and Pattabhi Jois stole off, sort of ran away to practice with Krishnamacharya at a young age, at 12, 13, 14 years of age, and practiced with him for 50 years thereafter. And then, of course, Pattabhi Jois was my teacher's teacher. Well, Pattabhi Jois calls this pose Vashisthasana. Iyengar calls this pose Visvamistrasana. Well, who's right? They're both taught by the same person. Well, I think Iyengar and Pattabhi Jois, it can call whatever pose they want to call, anything they want to. You know, that's their prerogative. They have that. You and I have to be careful to, number one, be precise about posturings and Sanskrit terminology. But then there's a little bit of malleability because different camps will call different postures by different names. I know that when I'm practicing with my teacher, he's going to call this Visvami or Vashisthasana. If I went to an Iyengar style class, I would have to know that this was Visvamitrasana. You'll begin to see these subtleties in Sanskrit terminology and posture names. And just be okay with it. Be malleable. Go with the flow, and don't worry that they're not calling it exactly what you think it's called. Just know that different camps will call different postures different things. Contraindications would be a recent wrist injury, of course, in either the half variation or the full variation. So Vyanavayu maintains cardiac circulation, nutrition and oxygenation of cellular tissues and the heart system. Vitiated Vyanavayu symptoms include ischemia, or lack of oxygen to the heart or other organs of the body. Sometimes can result in heart attack or stroke. Also, vitiated Vyanavayu will show with swelling in the lower extremities. So asanas for Vyana. Paschima Namaskarasana. It stimulates Vyanavayu. Garudasana calms Vyanavayu. And Matsyasana, breathing is eased as the chest expands. Okay? So Paschima means west, and Namaskar means great or salute. Now here, this may or may not be a basic pose. A lot of times people will have great pain in their wrists when trying to perform this pose. So what we could do to modify would be hold the elbows, or maybe even just put the fists together. The benefits: stretches the wrists, the forearms and shoulders, relieves carpal tunnel syndromes, and opens the heart chakra. Matsya is fish. Now here I'm in a very basic variation of Matsya, Matsyendrasana. Full version, legs would be in lotus. I'd be holding my feet in lotus, and my head, crown of my head would be on the floor. That wouldn't be basic. And I would need a lot of warm-up. Matsyendrasana is actually part of the cool down in a traditional class. But this posture, pretty much most people can do. And what we're focusing on is the expansion or upward movement of the chest. I'm not even allowing the neck to hang backward. All right? Benefits: chest expands and provides a pathway for deep breathing. Garuda means eagle. And here, of course, I have the eagle arms, elbows in line with the shoulders and hands away from the face to deepen the stretch. And the benefit stretches the upper back and provides relief for tight shoulders and neck, brings awareness to the heart and throat chakra from a subtle point of view. Udana Vayu is responsible for speech and exhalation, or will and intention as well, also comes from Udana Vayu. Udana Vayu stimulates the memory and, if balanced, aids in easing confusion and depression. Vitiated Udana Vayu symptoms include quiet or a hoarse voice, lack of memory, lack of creativity, or no drive. And maybe excess Udana Vayu might be someone with a very booming, hard voice, or someone who talks a lot. Huh? Asanas for Udana. And here I went back and forth between choosing Urdhva Hasta Tadasana and Ustrasana. I went back and forth, and I ended up choosing Tadasana because we had talked about it in forum. So Urdhva Hasta Tadasana stimulates the lymphatic system, Udana Vayu, and thyroid gland. Sasangasana improves the function of the thyroid and the pituitary gland and stretches the back of the neck. Balasana calms Udana Vayu. Urdhva means upward, Hasta's hand, and Tadasana's mountain, or Tara, right? And so I use this variation because the hands are upward and the head is up and back, so the neck is exposed. I think this is a good choice for Udana Vayu also because the feet are firmly grounded and there's a presence in the energetics from the ground as well as upward. Sasasana, or Sasana, means rabbit. And here I'm closing the energetics of the throat chakra of Udana Vayu. And someone who maybe had a lot of anxiety or who had the speech that was nonstop would really benefit from Sasasana. Balasana, the child's pose. Just lengthening the neck, relaxing the back, and keeping the sensory from the outside world, outside of the body, just allowing everything to be calm. So prana vayu, prana is movement of mind, thoughts, feelings, emotions, sensation, and perception. According to Vasant Lad, thought is a vibration of prana. Vitiated prana symptoms include dyspnea, palpitation, anxiety, nervousness, fear, inability to focus. Diseases include sleep apnea, stroke, grand and petit mal epilepsy, headaches. Asanas for pranavayu include Dvipada Viparita Karini, which calms the brain and relieves headaches, meditation, and pranayama. And in my view, all poses done with awareness and proper breathing are good for pranavayu. So I put Dvi equals Pada. Dvi equals 2. Excuse me there. Pada is feet, and Viparita Karani, inverted, or the act of doing. So maybe the act of inverting. And Padma is lotus. And here I'm in Padmasana. Someone brought up Sukhasana in the forum. And that, of course, would be a wonderful posture to balance pranavayu. Any questions? We'll talk more on the forum. But just for now, believe that today you are aligned with the energy of a flowing river. Your energy, your body is fresh and pure. Know too that as you align with this energy, that water is formless and shapeless. Know that water conforms to its environment and changes its environment in subtle, soft, tenacious ways. Water creates change in soft, flowing ways. It has a strength from within. Believe just for today that as you allow yourself to flow fresh and pure in your mind's eye, as a river does, know that your body will flow too in this way, soft, fresh and pure. Notice that all of the universe will begin to flow and move with you. Notice that you won't have to struggle or push. Just flow. Remember to move in subtle, soft, tenacious ways. Never harsh. Always soft. Thank you, everyone. I'll see you on the forum. Namaste.